Sciatic pain is when usually a nerve gets pinched and you get shooting sharp pain down the side of the leg, and sometimes it can be all the way down to the foot, not always. Usually this nerve is pinched somewhere in the lumbar spine, even though we feel it more often from the buttocks down. It's usually when there's a disc herniation that's impinging upon a nerve, or sometimes as we age, we can get bony arthritis and overgrowth that can also irritate this nerve, causing shooting sharp pain down our leg. So in order to diagnose and treat sciatic pain, often, have a patient come in, we do a physical exam on them, usually with certain signs you can see with bending over or, straight leg raise. This will often reproduce the shooting pain. That allows us to diagnose it's likely sciatic pain. To confirm this, we usually need to get an MRI to see where the nerve is being pinched. More often than not with sciatic pain, 80% of the time it will get better on its own without surgery, which is where it's beneficial to see an interventional spine specialist first. At this point, we can do an epidural steroid injection to put steroid around the nerve. It should usually calm down the pain within a week or so. Most of the time, this will usually resolve on its own within 6 to 8 weeks. We're just able to get you through faster with the steroid injection. Sometimes the nerve is not completely compressed, but often just the inflammatory factors in the area just really irritate the nerve, making it overly inflamed. So when the steroid gets around this nerve, it really calms down the inflammation in the area. So even if it's not fixing the disc herniation at that time, it will calm down the pain and allow your body the weeks and times that it needs to heal. Usually when you come in to see me for sciatic pain, first visit, we diagnose it. We need to order an MRI to pinpoint exactly where the nerve is being impinged or what's causing sciatic pain. So once we get the MRI, come in for another visit, we discuss, our plan, discuss the MRI and where the impingement's going on. After that, we just set up for an epidural steroid injection. When you come in for this procedure, you'll be laying down on your stomach. We'll use an x-ray to guide the needle in place and put the steroid around the nerve root to treat that. So to increase the likelihood of success, initially after the injection, we don't want you to, do too much movement for 24, 48 hours, just to allow the medication to set around the nerve, really calm down the inflammation. Then more long-term, and even somewhat in the short term too, really want you to do some physical therapy to work on strengthening the core and lumbar spine musculature, because this can really help you get better faster as well as prevent future disc herniations to cause sciatic pain. If you would like to schedule an appointment with me, you can give us a call or schedule online. Look forward to meeting you.